I'm Dr. Allan Perel, and this is Conversations in Medicine. I'm Dr. Allan Perel, and this is Conversations in Medicine, a program dedicated to bringing cutting-edge medical topics to the Staten Island and tri-state community. Today's topic is a little different. We have a bunch of people not dressed very well around us, except for Mike. We're going to talk about exercise for all. I have wonderful experts and a wonderful expert panel, people who do a lot of exercising and Mike Wilson, who will speak, well, I'll give you his title in a second, as a personal trainer. We're going to discuss exercises. We've come a very long way from my youth when Jack LaLanne was on television, and later on when Richard Simmons was on TV. The idea about exercise physiology has come really a very, very long way. And I want to thank everyone for being here. So here are my guests. I want to introduce Mike Wilson, who's a certified personal trainer. He works with one-on-one rehab on Staten Island and does a lot of personal training, both at home and in gyms. And really he has a large following of people who really do very well with him. I'd like to introduce my other guest, Charlie Ventura. Thank you for coming.
Thanks for having me.
Edis Grasevic. I say it right? Yeah. Okay. And Evan Perel, who's someone I know very well, who's my son. So welcome, welcome. Welcome, welcome. So Mike, tell us, what's a personal trainer?
So a personal trainer, in layman's terms, is pretty much a person that's going to go out, whether it be a gym setting or a home setting, and basically train the person to either get stronger into a particular routine or just in an everyday basis to get them functional through an everyday basis.
And how does someone get certified as a trainer? How do I know that if I see a trainer or if someone is at, say, I go to the JCC or
so
I go to
it's
LA
actually
Fitness, how do we do it?
it's actually fairly simple. It's basically you more or less you go online into an accredited organization. Let's say, for example, NASM, National Academy of Sports Medicine. They are pretty much the marketing standpoint of personal training, and then they're going to go into giving you a textbook. You get this textbook, you read through it, you say about 3 months to really study this material. And once you know the material, you take the test, you know the test, once you pass, now you're certified. But that doesn't stop there, because obviously everything comes with experience. Anybody can become a personal trainer. You can become a personal trainer for all that matters. You guys can become personal trainers. Doesn't make you the best, but now you know those guidelines. Once you know those guidelines.
Is there a test?
There is a test. You have to, the test is basically proctored in a actual facility where they're yours online. So once you take the test online, you pass the test, now you're able to go out into a gym setting. Or if you want to go into an individual setting, you can do that as well. That's basically what I'm doing as well.
So tell me, where's the best place to train? As a neurologist, I have a lot of patients who need physical therapy, and I know your group also does a lot of physical therapy. And when I think about physical therapy in a physical therapist's office, I think of all the equipment that's there, and people do very well, and all the exercises.
Absolutely.
And even one step above, even hospital physical therapy, where there's all the parallel bars and other things. And when someone does physical therapy at home, it's somewhat limited.
Absolutely.
And is it the same for a personal trainer? Someone who'd rather do it at home? Do you think they can get the same
You can
exercises?
definitely good benefit at home without any equipment. Just your own body alone is a weight right there. You can do so much with your body. Even just finding household items, whether it be a cup, bottle, can of peas, whatever you have at home, your household items, those things will definitely be beneficial towards you.
We have a special treat. We're going to do some exercises together. And I'm going to watch. And I'm going to do these sitting down exercises. And for all you fellow couch potatoes, you're going to do them with us a little bit later. But just to talk a little bit more about personal training, I have these big guys here. And you guys work out a lot. I'll ask you, about how often do you work out, Edis?
I work out about 6 days a week, 2 hours every day, so coming around 12 hours each week.
How about you, Evan?
Yeah, probably about the same. But I'm also playing a lot of basketball, so I always integrate cardio with my weight training.
And Charlie?
Same as Evan. I usually play basketball after I work out.
So tell us a little bit. weightlifting. And when Evan comes home, he tells me today was arms and chest day.
Okay.
Or legs day. And I try to figure this part out because I'm happy if I do my workout, my 40-minute workout. I do everything in that time.
Well,
so tell us about, what are they all talking about?
Well, basically you have, which is everybody's teenage years. I've been there. You want to go into bodybuilding. You know, everybody's looking to get bigger. They want to get, they want to show off the muscles. That's what a teenage kid wants to do. Listen, I was there. I've been there. It's a great feeling to know you're like, oh, okay, I can take my shirt off and no one's going to say anything to me because I got muscles. But working out 6 days a week, great, that's fine. 2 hours, yeah, you could spend that amount of time, but do you really need that amount of time? You could definitely get a decent workout within an hour and 15, depending on your mobility, your strengthening, and what you're doing to prep yourself in order to get into this program. But bodybuilding for sure is definitely one thing that you're going to want to do. You guys doing the basketball thing is great because that's going to high intensity interval training. You're going back and forth up and down the court constantly right there is a great exercise alone. You're looking at also aspects of agility. To be an athlete takes a lot of requirement to stay functional.
So let's talk about some words that I've heard. So we talk about cardio. What's cardio?
Cardio, everybody's favorite word. Cardio, I think, is more or less it's cardiovascular in a sense. You're training the heart to,
which is a muscle.
Exactly, it's one of your most important muscles, without a doubt. You're training the heart to beat at a specific rate. So if you want to get to a higher rate, you're going to train at a more high intensity rate. And if you want to keep the blood flowing continuously and actually stay healthy, it's in order for you to do, let's say, a treadmill run or a stepper or a rower. You have so many ergonomic type of activities that you could do in order to increase cardio.
That's really aerobic exercises. When we hear about Pilates or core, tell me about that.
Well, Pilates is definitely something, I haven't really experienced Pilates. I've definitely tried it. It's very, very difficult. It does involve a lot of core, a lot of flexibility as well.
What does the core mean?
So core is basically it's your foundation of your body. Without core, you can't move, you can't stand. Your core is your stable moment. If you're going to stand up, this has got to tighten first. If you're slouching over, this is a problem. Everything's going to come from your lower back. You'll see a lot of people, well, in the weightlifting, and I'm sure you guys have seen them in the gym, if they're doing a plank and their lower back is dipping in, these are things that you don't want in your everyday life. You want to make sure that you're always sitting up tall, and I'm sure everybody, as soon as I say that, will start sitting up a little bit better.
Of course.
So that's always the one thing, those things as core. Like again, I said, is the foundation of your body.
Young men here and young ladies out there, I go to the gym, there are a lot of women there too. Everybody's talking about weightlifting. Could everyone weightlift? Is there any reason, as a physician, we want to give proper advice to people?
Absolutely.
I don't want people picking up 300 pounds because that's when they'll come to my office the next day and have terrible back pain or neck problems or other things. So tell me about weightlifting. Should everyone do weightlifting? Is it something part of your routine?
So in my expertise, I've always tried to break it down first. I try to build it up from the bottom up. A lot of people like to look from the top to the bottom. Say, okay, yeah, I could lift weights, no problem. I'm sure I've done it before too. I've never lifted weight before. Let me go into the gym without any type of expertise or any type of following and try this out. Not the best way to do it. What I try to do is if I'm training someone, I'd like to break them down first. All right, let me see how well they move. Are they able to move through a squat? Are they able to move through even just a normal shoulder flexion coming above their head? These movements may restrict if you start to load them with an external load. So what we try to do is get their movements down, patterns down first, and then start to add weight. So it's necessarily, to answer your question, no, it's not a bad thing.
So there's a way for people to do it. And as you said, even whether it's a can of peas, a 1 pound weight,
Absolutely.
5 pound weight,
Absolutely.
we don't have to use very heavy
Absolutely,
weights.
because it's only going to help with bone density as well.
So we're going to do something special. We've never done this before on this show, and the show's a little over 2 years old. We're actually going to get up from our chairs, or have some people get up, and Mike's going to go over some exercises. And I'd like everybody in the audience who's able to stand up to maybe do some of them with you. And,
Sure.
and we always say the caveat, make sure you're healthy enough to do it. And maybe, what do you tell people? I mean, you have clients or patients.
Well,
what do you tell them?
If I have clients coming in, my first my first question is to make sure that they have doctor clearance before they come into a training, making sure that they're clear before everything else. I always check, make sure they have no injuries, prior injuries. So I'd like to know their history.
Absolutely.
Prior.
Everybody in the healthcare field will do that.
Absolutely.
So, Mike, let's get started.
Sure.
So let's do some things. And
Edis, you want to join me?
of course.
Start off with a squat.
So tell us
All right.
what a squat is.
So a squat is basically something that everyone does every day. You're sitting down, you're standing up. These are things that we're going to do constantly. So it's more or less. Let's go over it real quick, Edis. So I always like to start with first. My feet are always nice and straight, right? Okay. The first thing that we're going to do is tighten up the core. Okay. The core is obviously right here. All right. This is our stomach. This is our main concern. Keeping this tight is always going to be our foundation to keep us upright. All right. So the second thing I'm going to have him do is actually just stick his hips back. All right. So he's sticking his hips back. He should feel like he's going to fall backwards. All right. Now, if you're doing this at home, I always recommend try to have something that's in front of you. All right. Making sure that you have support in front of you, or if you have a chair with arms. All right. I find that to be the best possible way to do things. What you're going to do is you either reach back for the chair. Well, since you're pretty fit, I'm going to have you just go hands out. All right. Now, what I'm having him do to have his hands out is going to counterbalance his weight, so he doesn't fall back into the chair. So he's going to engage here, keep this nice and tight, hips back, and then all he's going to do is bend his knees down into the chair. Good. Okay, now while he's in this position, I don't know if you could hold this for a couple seconds, Edis. So he's going to keep this tight, all right? And he's going to put all his weight through his heel, all right? Now what he's allowing to do is he's going to shift his hip back, and now he should feel mainly the quadriceps, his hamstrings, and his glutes working, all right? His core has got to be fired the entire time as well, all right? You can come on up, Edis. All right, so as he comes up, now he's working into a standard of activating those muscles in the concentric phase. So he's going down and eccentrically, and then coming up concentric to activate all these muscles.
So if someone's home and they take their dining room chair, or
Sure.
not a recliner, of course, nothing soft, they could do that?
Absolutely, absolutely. Like I said before, making sure that they have something in front of them.
Right.
If they don't have anything in front of them, I wouldn't recommend it. If they do, preferably a chair with arms. All right.
Chair with arms and near a table or something or somebody
Absolutely.
with them.
What I could do is, Edis, I'll pretty much demonstrate. If we're going to sit down into a chair, for example, I'm going to have you sit. So same thing as a squat. You're going to reach back for the arms, and now you're just going to sit down nice and slow, tap the chair, and then you're going to stand up. All right. So that's another way of support that we can do. Another way of support is also thigh support. Again, you want to make sure that you have the balance and the stability to actually stand up nice and tall and making sure you're not falling over. All right. So again, the squat is a functional exercise. We're doing this every day. We're sitting down, we're standing up, we're using it when we go to the bathroom, we're using it when we sit down at a dinner table. These are everything. These are an everyday exercise, for example.
So back to our wonderful audience out there. So how many times should they do this?
I would try to be
And this is today their first event.
So if you're looking for about a first event, I would say no more than 3 sets of 10.
So 10, and then how long do you wait between sets?
You're looking for about 60 to 90 seconds of each exercise.
Okay.
So that's usually the main basis. I like to do is going to build up hypertrophy, which is going to gain that muscle size. So 3 sets of 10 is usually the prime number of where we like to be as far as any type of exercise.
And if they do it tomorrow, the next day build up, or how do they go higher?
I like to take, if we're going to start as a beginner, I usually try to do it 3 times a week. As they get more advanced, then we start moving into different exercises where we're still hitting the same muscles, but now we're also engaging similar routine of bending the knees and sitting down, standing up.
Interesting, marvelous. So that's one exercise everyone could do.
Yeah.
You said you had a few.
Yeah, I have a few. You can take a seat, guys. Thank you, bud. Evan, you're gonna come on up. I'm gonna show you. We're gonna demonstrate the shoulder press. All right. I do have some dumbbells here.
Stay over there, because we're tethered to our microphones.
So basically, what we're gonna do here. So I have 20-pound dumbbells here. So Evan, take one. I'll take the other one. Okay. So basically, what he's gonna be doing is a shoulder press. So shoulder press is basically, obviously, another core exercise. So we're keeping this engaged the entire time, because what happens with a lot of people, we like to press over our head and we start to arch from the lower back. We don't want that. Okay, so what I'm going to have him do is first teach him how to engage here, keeping his stomach in nice and tight, and then he's going to bring the weights up above his shoulders. Okay. Now notice everybody likes to do elbows out, which is fine. That's the bodybuilding way. That's how everybody was taught to do a shoulder press. Fine, no problem. So what I'm going to have him do from this position, He's going to press straight up, and then he's going to come right back down, okay? Now notice he's keeping this tight the entire time, making sure his lower back is not arching. Again for me, Evan. Good. Okay, so what we're looking for as a personal trainer is making sure he's not coming up forwards in front of him, he's not going too far behind him, and also he's controlling the weight as he's pressing up and controlling it on the way down.
Mike, that seems like a lot of weight, 20 pounds each.
So 20 pounds is...
Could someone do it with less weight?
Absolutely. You can definitely do this. You could even just take a medicine ball, all right? You can bring them down, Evan. You could take a medicine ball. You could take, for example, if you had 2 bottles of water, you could take 2 bottles of water the same way.
Like the regular bottle of water.
Bottle of water.
And go straight
Yep,
up.
that's it.
So I know you're going to do some exercises with us sitting in a seated position for a few minutes.
Absolutely.
But that's one of the things they can do.
That's definitely one of the things. And same repetition, same amount of sets, 3 sets of 10, around that range. I wouldn't do anything more. I wouldn't do anything less. That's, you know, you're more or less where you're going to be at as far as training aspects.
And what weight would you start with? I mean, you said a bottle of water is a pound probably. So.
Yeah, you'd say, I mean, it depends on the person. It depends on the client. Obviously, I'll run them through a little bit of a screening test and try to see where they are as training aspects. Thank you, Evan.
Thank you.
Charlie, we're going to come on up, pal. I'm going to show you one more exercise. All right. So I have here little resistance bands, okay? So about a 5-pound resistance band, so that's probably going to be fairly easy for Charlie, all right? But what we're looking for is we're going to call this one the bicep curl, all right? So Charlie, I'm going to have you take the handles. I'm going to have you step right in the middle of the band, okay? Now, with the difference, the good thing about resistance bands that I like the best is that as you raise the band or stretch the band, the weight increases. So the glorious thing about this is if I have Charlie spread his feet out, it's going to make the bicep curl just that much harder, all right? So Charlie knows what a bicep curl is, but people at home, they might not know what a bicep curl is. So basically it is elbow flexion. So all you're doing is bending the elbows, you're coming up to this position. I like to hold for about 2 seconds and then come back down nice and slow, okay? Always try to do everything exercises nice and slow, because if we're moving through the movement quick, you're not getting too much benefit. You're using momentum. Physics is going to take over. So we like to fight against physics and slow things down to really engage that muscle. So if we go through a couple of reps here, all right, notice how, hold it right there for me, Charlie. Notice how this is right here, this bicep, all right? So this is what we're looking for. This is, look, the biggest contraction right here. So if we get this, we're good. Second thing is also his shoulder blades are back. We always want him nice, good, tall posture. His chest is proud, okay? Tight stomach, that goes right back to core, all right? Again, core is that foundation of the body, so we always want that nice and tight the whole time, okay? You come back down, all right? Again, with the resistance band, you can mess around with the tension of it, all right? Good, Charlie, thank you.
No problem.
So tell me, with using this device, because I wonder if there's maybe one other exercise you could do with
Sure.
it. So is this something that everyone should have? Or where do you buy one? and how do you get
So
one?
I actually found this on Amazon, believe it or not. I find Amazon to be the cheapest. If
Okay.
you're going to pretty much...
We don't want to promote anyone, but anything
yeah,
reasonable.
no, yeah.
I think they're not very expensive, are they?
No, I wouldn't spend anything more than 10, 15 bucks, honestly. And you could find these at other sporting goods stores. Again, you could do so much with this. You can have a seated position. We could do a shoulder press with the bands. We can do raises, bicep curls, back rows. And you
Maybe
could even,
while you're standing, maybe you could
Sure.
just a couple of exercises
Sure,
you could do
absolutely.
with this.
So another exercise that I would like to do is called a back row. So this one, you'll have a standing, obviously. You'll be bent over, so knees are bent, tight stomach. And then what you're going to do is you're going to pull the band straight up, focus on squeezing the shoulder blades, and then resisting them down. Squeezing the shoulder blades, and then down. Okay, so notice that we're not coming up here. We don't want the upper traps working too much. We want to keep the shoulder blades down. So allowing the shoulder blades to stay down is going to make sure that we're using the lats as much as possible. There's also a few other exercises, lateral raises. Same step. So we're going to step on the band, and then opening up, and then coming back down. Okay. We like to mess around with the ankles a little bit. If we have our palms out, it takes the shoulder out of impingement. Okay. So many various exercises that we can do. Now, if you also have a pole at home, wrap the pole around, wrap the band around the pole, and do some back rows.
If someone doesn't have the resources to have a personal trainer,
Mm-hmm.
is there websites? Would you go online and they'll exercises that you could find or show you how to do it, or YouTube?
You could definitely resort to online sources. Again, the glory about having that personal trainer in front of you is that person to push you and to make sure that you're doing the exercise right. Online resources, great, no problem. but are they there to correct what you're doing wrong? Because it may be just a small movement that you may do wrong and it may not feel right for you. So yeah, online resources can help you and they can't help you at the same time. So I always like to have that person in front of you. I'm not in-person type.
No, and I think it is best. Thank you, Michael. I'm
Of
going to have you
course,
sit
yeah.
down, and now
Yeah.
we go through a couple of exercises that we could all do sitting down.
Sure.
Because I'm sure somebody is sitting down while they're watching us. They're on the couch, and we're going to go all the way to a couch. Couch, and the goal is for everyone to exercise, at least do something because they watch the show.
Absolutely, yeah.
So they're sitting on the couch, sitting on a recliner. What could they do?
It's
We'll try to do it.
basically, I always like to start off with the core. I know you can't really see our legs, but our legs would be the first thing to use. Is we place one hand over our knee, so we're going to go opposite. So we're going to go left arm to right knee, and then what we're going to do is going to lift the right knee, and then simultaneously press down with the left hand. And you're going to feel your stomach kind of tighten up a little bit. All right. Again, this is an exercise that you want to do sitting up nice and tall. You don't want to just kind of fall back into the recliner or the couch. It's not something you want to just relax and just be like, okay, let me press into my knee a little bit. Sit up nice and tall. Drive that hand into the knee. That's something that we could do just for the core as well.
And you can do the other side, of
And you
course,
could do the other side, of course. Yeah, absolutely. Something like that I like to do maybe about 10 seconds, really engage the core a little bit, and then relax about 10 to 20 times. Another thing is you could just go through regular shoulder press, even just getting your hands up above your head.
So we'll do that.
Just coming straight up. This is really going to open up the lats. This is really going to get that shoulder range of motion, and just going back down and then back up. Simple motions just like so.
So we could do that during the commercial? If the,
Absolutely, yeah.
if the TV show is not that interesting?
If you're just kind of just relaxing and just kind of, you know what, my arms kind of feel heavy. Let me get them moving. Let me get my shoulders moving a little bit. Another exercise too is if you're just going out to the side, opening all the way up, nice big
We'll do it.
circles,
Okay.
something
We're
like
going to
that.
knock into each other, but we'll try. So while we're doing that, and actually the crew is doing it, everyone here is doing it. Our producer David Marcus is doing it, everyone is doing this. Okay, so let me ask you the concept. No pain, no gain. I'm a doctor. I've never liked that concept.
Yeah.
Anything that hurts is a bad thing. Not just for me personally, even though my tolerance for pain is okay. But the idea of no pain, no gain, when somebody comes into my office and they said no pain, no gain, I did this and it hurt.
Yeah.
And it still hurts and it's weeks later. So tell me about what you think about that.
I hear it a lot from my patients when I'm working at the physical therapy place. There's a difference between pain and like fatigue and like a burn. You know, I'm sure you guys know. You guys could pretty much agree with me on this. If you're feeling the burn, that's what you want. You want that burn. And I feel like a lot of people resort to that as pain. It's not necessarily the pain. It's a good pain. So
So how do you tell bad pain?
how do you tell bad pain? I feel like you could tell the difference. If it's bad pain, it'll pinch. It'll really kind of fire up if it's nerve pain. If it's something to deal with bone pain, you're looking for that pinch, and you're not looking for.
Does it last longer?
Absolutely. Well, you're looking for a lot of discomfort.
Numbness?
Absolutely, and that's something you don't want.
I think
that
that
means
I
they're coming
say,
to you.
Numbness, tingling, those
We want
kind
to
of
avoid
things.
those
right?
things, yeah.
Not being able
absolutely.
to turn your do
Absolutely.
full range of motion, can't turn your neck.
Yeah, now you're looking for a lot of issues.
Exactly. So we want to do. So back to a few things. About what age should people start working out? My son went to the JCC, and we're trying to figure this out. They wouldn't let him into the gym until he was, I think, 12 or 13.
Okay.
And he banging on the door and saying, "I want to go in." So that was one thing. But when should kids start? Is it too young an age with bone growth and things like that?
Not necessarily. I mean, again, that just goes back to how they move. You know, if the child knows how to move well, you could start them at any age. I mean, you see a lot of kids that are not normally moving too well. I wouldn't give them a weight. So if you're going into the gym at 14 years, I usually kind of recommend that's a good start.
How about, could you be too old to work out?
Not at all. Not at all. You could definitely not be too old. Again, I'm going to the gym and I see guys that are almost as old as my grandfather, and these guys are moving a decent amount of weight. But again, this is increases in bone density, which is healthy, and it's going to keep you a healthy lifestyle going on and going forward.
So that's so important with the reason people do a lot of weightlifting, other than these gentlemen here who want to have big muscles, is really to keep, is really to keep and impress the young ladies, I'm sure. Of course. Is to basically keep your bone density there.
Yeah, your main concern of working out is to stay functional.
And think about if you're an astronaut, why do you lose bone density? It's because you don't have gravity, so that
Absolutely.
weight is not going on
Absolutely.
there.
Yep.
So it's interesting. You talked about talking to your doctor before you start. What if someone has knee problems, hip problems? I've got a hip problem, and I go to the gym. The elliptical is okay for me, but doing other things really hurts my hip, and one day I'm going to have a new one in there, so I'll start from scratch. But with people who have isolated problems, are you still able to find a regimen that works for them?
Absolutely. I mean, you could go back and talk to the doctor. If they are seeing a physical therapist, try to resort to a physical therapist and see what their game plan is first. I always like to go towards the professional, the person that's dealing the most. So the doctor, the orthopedic, is usually the go-to guy. You know, what are the limitations for this person? What can and can't I do working with this patient?
So now I'm going to surprise the gentleman at the table. So I'm going to ask you all a question. What do you get most out of working out, Charlie?
A pump.
A pump? Tell us about it. Tell everybody. Everybody wants to know. Because when we see all of our kids and all of our family and say, I'm going to the gym, you come back with a big smile on your face, whether it's from endorphins that occur there, or you met somebody nice there, or some friends. Tell us, what do you get most out of it?
Well, to me, going there and just working out in general, how you feel after is what I like going there for.
Dennis, how about you?
I like to try to increase my strength. So anytime I go to the gym, I go with the intentions of trying to have a heavier lift or trying to move weight that I didn't think I could move in the past. And just seeing myself get stronger and bigger really makes me happy.
Is it a social event? Is there see friends and things like that?
It's a social
Or do you like going alone?
I prefer to go with my friends because it's kind of fun to make it a competition with them with who's going to be able to lift more sooner. And it's just you guys motivate each other and push each other to be better.
How about you, Evan?
It makes me feel healthier, which is, of course, very important, happier, and I feel more confident since I've started lifting. I also feel like it is a big social niche, and I've met a lot of friends, even at this table, that I've met through the gym. And even when since I transferred schools, I went from Oneonta and I met friends at the gym, and then I went to Pace, a school where I didn't really know anyone, and everyone was already in that groove. And I was able to meet friends at the gym just because he would spot me, or we would start talking, and just, it's easy
Spot you means what?
when you get behind someone and make sure they don't drop the weight on themselves.
Which can be dangerous,
Yeah,
right?
of course.
If I don't want that.
You know, it's funny, as a physician, I see all the people who didn't spot so well. Or things that fell on people's heads, or people fall down. Or as Mike did before, they didn't have the right balance, and they tried to do the squat, and they sort of wind up in a different position. You keep on using the term lifting. And does that include your cardio? Does it include, do you guys do all those things?
I just prefer lifting to actually lifting weights.
But I'm saying with cardio, do you do all those other things too?
Of course, I feel like you have to implement everything throughout your in your routine, or else your body's gonna show that you haven't done cardio. If you don't run, then obviously you're gonna. If men tend to keep fat on their belly, you're gonna obviously have a little belly fat. So keeping consistent with cardio and weight training together is very important.
So I want to thank everyone. I mean, it's a team approach. I mean, you have to have the internal drive to do it.
Absolutely.
You have to have the time to do it, which you have to make the time. We all try. And having a personal trainer, really, I've learned so much from you. And I've seen, the work you guys do, and that difference, that little extra, really does add up to a lot.
I appreciate
whether
that.
it's strength, whether it's endurance, whether it's just the ability to move things better, range of motion, things like that.
Absolutely.
So thank you so much, and thank you for showing us the
having me.
exercises.
Yeah, of course, anytime.
Have a good night, everyone.